Hello everyone. Today we'll be starting about the topic sulfonamides and sulfur category of antibiotics. I'm Shubha Banerjee, Associate Professor of Breno University, delivering this lecture. We know antibacterial plays an important role killing or inhibiting the growth of bacteria. And sulfonamide is a primitive category of the drug which plays an important role for the killing of the bacteria. Now we should know what is sulfonamide. Sulfonamide are a group of man-made or synthetic medication that contain the sulfonamide chemical. So you can see the structure here. This is a sulfonamide category, and this is the SO2NH2 functional group here. So that is useful for the killing of the bacteria. Now they may also be called the sulfur drugs. Sulfonamides are also devoid of antibacterial activities like anticonvulsant. This drug may also contain the sulfonamide category, but they do not have the antibacterial activity. They are having the anticonvulsant activity also. The sulfonylurea, thiazide, diuretic, and the newer drug group based upon the antibacterial sulfur. The first sulfonamide was tretinoin prontosil, which is the which was a drug. The first commercially available antibacterial drug is relatively having broad effects against gram-positive cocktail and not against antibacterial. So these are the different category of the drugs, which is sulfonamide and sulfonamide. Different derivatives will be there. So on the basis of sulfonamide classification, there will be classified account the basis of action, duration, site of action like this. Just wait. But our concern is to basis of chemical structure like sulfur N1 substituted sulfonamide, N4 substituted sulfonamide, both N1 and N4 substituted sulfonamide, and miscellaneous category. So we will be going to elaborate the structure. Now you can see the structure of sulfonamide derivative. Here is a structure. One aromatic ring is present in between the structure. One sulfanilamide group is there, and one R group N1, that is the N1 substitution, and the N4, that is a para-amino. So N1 substitution sulfonamide like sulfanilamide, that is the R and R1. This is known as the R and this is the R1. So there are different R and R1 will be changing, and as a result, the drug's name will be changing. Like sulfanilamide, there is no such change. This is the basic structure, sulfanilamide. And sulfositamide at the R1 position, there will be COCH3. Acetamide group has been introduced. Now sulfadiazine at the one position, diazine will be there, nitrogen containing somal. Next, sulfomethoxazole. This is the nitrogen and oxygen containing methoxazole. N4 substituted sulfonamides, that is the prontosil. At the fourth position, the changes has been done. N1 and N4, where two R group has been changes, succinyl sulfathiazole and phenyl sulfathiazole. And there are important drug that is the trimethoprim, which is having the structure such as the, you can say, that is do not contain the sulfonamide ring, but they are having the very good activity, the sulfamethoxazole. So this is the trimethoprim where 3-methyl group has been incorporated and one diazine diamine ring has been introduced. And the N4, that is a prontosil, and this is the mefenamide or mefenide, which is as a fourth category. Now that is coming to the different structural derivatives. This is the basic structure here. Now there are another category of the like sulfametazole, sulfaisozole, sulfametazine, sulfametazine. Next. This is the SAR. First, we should know this drug structure is very important. So sulfonamide skeleton is the minimum structural requirement for the antibacterial activity. The structure should not be changing. This is sulfonamide ring that should not be changing. The amino and sulfonyl groups of the benzene ring are essential and should be in the 1 and 4 position. SO2NH and NH2, this should be in the 1 and 4 position. This is the basic ring. And if there is changes in this position, there will be activity lower, increased or decreased maybe. The N4 amino group can be modified to the drugs, that is this position, which are converted to free amino function in B. Next, sulfur atoms will directly link to the benzene ring. Replacement of the benzene ring by other system or other introduction of the additional substituent may decrease or abolishes its activity. Exchange of SONH and CONH by if the SONH group is replaced by the CONH, activity will be reduced. Okay. Next, on N1 substitution, sulfonamide, activity varies with the nature of the substituent and the amino group. With substituent imparting electron-rich characters to SO group, electrostatic activity increases. Heterocyclic substituent lead to highly potent derivatives, while sulfonamide, which contain a single benzene ring at N1 position, are considerably toxic than heterocyclic drug antibodies. The free aromatic amino should recite para to sulfonamide. This is its replacement at ortho or meta position results in compound devoid of antibacterial activity. The active form of sulfonamide is the ionized active form, and maximum activity is observed between the pKa values of 6.4 to 7.4. That's another category of there. Substitution in the benzene ring of sulfonamide produces inactive compound. Substitution of free sulfonic acid SO3H also reduces the activity. Okay. Now going to the different synthesis of sulfositamide. According to syllabus, this is important. That is sulfanilamide, which has been reacted with acetic anhydride. One molecule of water will be reverted and says the CO group inserted here and here. Okay. Next partial address will be there, says the CO group inserted, and only NH2 will be remaining, and this group will be retained. This is the sulfositamide. Synthesis of sulfamethoxazole. This is one of the sulfamethoxazole means at the one position methyl containing oxazole is present. So first you have to take the N5-methyl isoxazole paranomic acid. This moiety should be taken previously. Then with the removal of CO2, we can get the 5-methyl isoxazole 3-amine. Now along with the PABS, that para-amino benzyl sulfonate chloride, with the liberation of one molecule of HCl, sulfamethoxazole has been synthesized. Trimethylgroup syllabus is also there. I'm not discussing elaborately now that soon. Now 4-amino phenyl sulfonyl benzamide. So at the fourth position, you can see, sorry, not position, at the one position you can see there is a benzene ring. So first one chloronitrobenzene will be taken, that is sodium sulfite. Formic acid is there, 1-nitro-4-nitrophenyl sulfonyl benzene is reacted, prepared. Molecule has been doubled. Next, the reduction of the SNHCl, dapsone has been synthesized. Action, sulfonilamide is a inhibitor of the bacterial enzyme dihydroxyapatite synthetase. That is one of the enzymes for the synthesis of the para-amino benzoic acid, one of the important components for the cell wall and necessary for the folic acid synthesis. The inhibited reaction is normally necessary in this organism for the synthesis of folic acid. Without bacteria, it cannot replicate. So, sulfanilamide will be preventing the dihydroxyapatite synthetase enzyme. Trimethoprim is also an important drug, which is a reversible inhibitor of dihydrofolate reductase, one of the principal enzymes catalyzing the formation of tetrahydrofolic acid and from dihydrofolic acid. From DHF to THF, that can be synthesized through dihydrofolate reductase, but that enzyme will be inhibited by the trimethoprim. Tetrahydrofolic acid is necessary for the biosynthesis of bacterial nucleic acid and protein, and ultimately for the continued bacterial survival. Inhibiting its synthesis then results in bacterial activity. Trimethoprim binds with such a stronger affinity bacterial dihydrofolate reductase as compared to mammalian compound, allowing trimethoprim to selectively interfere with the bacterial biosynthetic process. Trimethoprim exerts a synergistic effect with sulfonamide. This is the activity where vitridin and PABA, para-amino benzoic acid, Dihydrochloride enzyme is synthetase enzyme is working, where sulfur methoxyl is working, then the dihydrochloride synthesis will be inhibited. But if the drug is not acting, then dihydrochloride will be converted to dihydrochloric acid, then to tetrahydrofolic acid. So that process is inhibited by the trimethylase. Okay. This mechanism is again shown here. Now, there are different side effects of this drug, like they are potential to cause a variety of reaction, including urinary tract disorder, hemobiotic disorder, hypersensitivity reaction. When used in a large dose, strong allergic reaction, one of serious Stevenson-Jones syndrome, toxic epidermal nephritis. Some of the original supplement drugs were derived from azodiazide and had the interesting effect of temporarily turning patient rate. There is Stevenson-Jones syndrome, life-threatening condition affecting the skin, in which due to the cell death of epidermis separates from the dermis, like the dermatitis problem. In many cases, I have seen that. In case of this drug's action, the skin has been in patches of red. Syndrome is thought to be hypersensitive, and this is not treated. Adverse reactions are more or less more here, like thrombocytopenia, anemia, and hepatic necrosis. There are another advanced heterocyclic which causes type 1 hypersensitivity. The second in 4-aminonitrogen, that is the stereospecific process homocysteine metabolic, which can causes the hypersensitivity reaction also. This is the Dapsone. See the structure, which prevents the dihydrochloride synthetase, is a bacterial, which is used for the leprosy combination with the rifamycin and clofazimine. It is also used to both treat and prevent the pneumocystitis pneumonia and toxoplasmosis. Dapsone by mouth was one of the first medication used to treat moderate to severe acute vulgaris, used in the prevention of malaria. Dapsone also used to treat autoimmune disorder like cutaneous lupus, erythematosus, cytopenia. It is also used in the treatment of dermatitis, herpetoformis, and Raleigh glomerulonephritis. Has been used as a monomer in the design of dye-adsorbent pigments. Next, is the adverse effects. Again, we are seeing to see hemolysis and with hemophilia can be found. Toxic hepatitis and cholestatic jaundice can be found. Now, it is a trimethylene sulfate, so a very good combination of the drug that is used for the lung infection, persistent cough and chronic cough, by bacterium for pneumocystitis, zero risk. Previously studied. It is used for the skin infection also, traveler's diarrhea, infection caused by bacterium called the toxoplasmosis, urinary bladder or urinary tract infection, that is a water infection, that can also be treated through this combined drug. Respiratory infections such as bronchitis, ear infections such as otitis media, an infection called the nocardial disease, which can affect the lungs, skin, and brain. It may be used to both treat and prevent pneumocystitis pneumonia in people with HIV and AIDS. It can be given orally or intravenously. Diarrhea is the side. The mechanism is synthesis same, sulfonamide with dihydrosynthetase, which will be formed with dihydroxylic acid, which will be converted to tetrahydrofolic acid. Dihydroxylic along with the trimethylene is active. These are the very short description of the drug, where it is active. Now, thank you for the listening. To prepare along with your presentation and activity. Practice it